Everybody, I am here with Dr. David Wiss. He's got an app called Wise Mind Nutrition, and there's so much more intro I can give him, but we'll get into a lot of that coming up. His Instagram is, what's your Instagram? Dr. David Wiss.
Dr. David Wiss.
Yes, just wanted to make sure that was completely. And how do you spell Wiss?
W-I-S-S. It rhymes with kiss.
All right, Dr. David Wiss. So I noticed that you're in a chapter of your life, it seems. You were in health and fitness, and then before that, there was another chapter of your life, and after that, which is kind of like where you're at right now, at least from my perspective, which is now you're helping people. But I'd like to start back, like maybe even before you got your degree, and could you start there with your life and kind of walk us through how you got to where you are now?
Absolutely. I can say that I lived two lifestyles in one lifetime, very different type of energy between ages 12 and 24, and then 24 to current, right? So it's predictable. Teenage years, early 20s, people are partying, causing harm to our health. And I did my fair share and then some. I did enough for the whole neighborhood. How about that? Mm-hmm. I taxed myself to a point where I was very unwell. And this was, in my about 3 months before my 25th birthday. I hit a pretty hard reset after having lived in some places that I didn't choose to live and been through some tough times. And I found that nutrition and exercise and sunlight and sleep had a pronounced effect on me. And I wasn't sure if it had the same effect on other people. In other words, when I started eating differently, within a few days, I had energetic changes. My skin was changing within a few weeks. My mind was clearing up. I was starting to feel safe in the world. And I knew that I was on a wellness path. And, I stopped drinking alcohol, started eating food, and really started chasing my dreams that I didn't even know that I had. And it unfolded pretty quickly that I was, into helping people. I was into exercise. I was into nutrition. So it was, let's go. And I ended up, doing some more schooling and ended up, getting a master's degree in nutrition with the goal of using nutrition to improve recovery. Nutrition for addiction recovery was my original hill that I was on. And my original flag that I stabbed in the ground, that nutrition can improve addiction recovery. And I built a whole company around it called Nutrition in Recovery, where we started bringing our services to treatment centers here in Los Angeles and beyond. So that was the beginning of the journey.
What treatment centers were you working in?
Oh my goodness. I don't even know if I should say names. We've worked at over 50 treatment centers here in Southern California, and some places I've been with for over 10 years, where we run groups and do one-on-one counseling. There's some really great treatment centers that do adolescent work that we've been a part of. Sometimes they just want us to come in and run a group for a couple months and maybe meet with some clients that have disordered eating. But yeah, the beauty of our world today is that I've been able to do some consulting work all over the world. And it's awesome to be recognized as a pioneer in that space, because 2012, when I was screaming from the rooftop, let's integrate nutrition into rehabs, people looked at me like I was crazy.
Yeah, that's nuts.
It's nuts. It's nuts. They're like, what are you talking about, man? There's no real evidence here. Fast forward 11 years, there's thousands of dietitians working in treatment centers across the nation. And it's a known thing because nutrition and, intersects with eating disorders, depression, anxiety, trauma, gut health. There's just this awesome intersectional space that hasn't fully been explored. So, I'm very grateful to have been one of the people that was willing to take a few darts, to take a few arrows early on to be able to say there's something here. Let's collect some data. Let's do some research and let's see what happens.
So did you do research? Like, do you have, like, were you the one that had to sort of pave the path into this?
It's funny you asked. We did a couple, master's thesis research studies of cooking classes in rehabs. And I ended up going to UCLA to do a PhD with the goal of doing this research, and I had a pretty elaborate plan. I'm sure you can imagine, young David Wiss coming into UCLA and like, we're going to change the world. And, I'm in the public health department and I really wanted to do a full revamp on an entire facility and obviously be able to compare it to another facility. So it has to be facilities that are under the same organization, right? And, in public health, we don't really do research in the private sector, right? So let me just clarify, all the work that I did in nutrition and recovery was always in the private sector, which means that, the insurance companies weren't really paying for it. The upper management decided they wanted to have it. And the bigger goal was, how do we get this integrated into the healthcare system, right? Mm-hmm. So that people that are coming in to a publicly funded rehab could have access to a nutrition group, high quality food, colorful fruits and vegetables, right? And so, when I got to UCLA in the School of Public Health, I had some ideas about, doing this work in a publicly funded treatment organization. And, basically the vision was, and I'll share it. I never did it. I'll share it. Hopefully someone else will do it, right? Because,
cool.
It might not be me, was to be able to, do several tiers of intervention. One would be to revamp the food service operation, right? Which is like expensive, organizationally challenging, right? Obviously, when you're in an organization, you buy food from major food distributors, big food, right? That come on big trucks, right? Mm-hmm. And they're in high quantity, right? So there's a compromisation of quality, which if you understand the system, you know what I'm talking about, right? You just can't buy some of the foods that maybe you and me eat in the kind of bulk that you need for these large scale operations. So it would be a food service overhaul. It would be nutrition groups weekly based on the curriculum I built. I also built curriculum at Nutrition and Recovery to, help people teach this information at treatment centers. It would be one-on-one counseling, at least one session for all the clients, all the patients, and perhaps more for those that have disordered eating, malnutrition, other needs. And then, of course, possibly, I wasn't sure about this piece. I say, of course, because it makes so much sense, adding some dietary supplements, right? Some really basic omega-3s, magnesiums, things that people coming into rehab are definitely lacking, B vitamins, et cetera. And, the question that has always been a head scratcher was like, all right, what's the outcome? What are we studying? What are we actually looking to change? Because in nutrition research, we do a lot of biomedical outcomes, right? You look at, lab values, blood pressure, classically cardiovascular markers, BMI, all of that predictable stuff. And then in the area of nutritional psychiatry, nutritional psychology, we start thinking about other outcomes, mental health outcomes. How might nutrition improve, depression, anxiety? Anyways, the original, vision was to see if nutrition can improve recovery outcomes. Can it help people stay sober, right? Mm-hmm. People that have had struggle with alcohol, crystal meth, prescription medicine, like can we heal their gut? Can we improve their chances of staying sober? And then, in reality, it's difficult research to do because the follow-up on that population is pretty low, right? So it's hard to really be able to say if we, do this expensive work that we're going to be able to get data on all these people, right? The current data doesn't suggest that would be an easy thing to do. You're now looking at self-report. People are telling you if they are or they not. So then we had to think about what are some other outcomes? Like, can we just use nutrition to improve depression, right? And we have pretty good data on that. But, lofty me, I wanted to put people in brain scans and do PET scans and functional MRIs and be able to look at some very convincing outcomes. And, I've always been interested in inflammation and neuroinflammation. There's a lot of data to suggest that when people have gut-based inflammation, whether from poor nutrition, from drugs, alcohol, etc., intestinal permeability, that inflammation can travel throughout the periphery and eventually cross the blood-brain barrier. And the blood-brain barrier is permeable. Maybe you've heard the term leaky brain, right? And so it's a area of interest of mine. Perhaps if someone has neuroinflammation, perhaps it's impacting the amygdala and making more anxiety, more craving, etc. Can we use nutrition to help reduce inflammation that starts in the gut, reduce inflammation in the brain, improve mental health, and be able to increase the likelihood of someone staying sober, having a quality of life, etc. Anyways, it's a really expensive study, too lofty. I didn't get it approved for my doctorate training just because no one in the department was qualified enough to understand really what I was talking about. So once again, it was darts and arrows. People looked at me like I was crazy. Perhaps, 5-10 years down the line, that study will happen, but it was too early for it. It was too early. We need a little bit more data to be able to support all of the different angles in the study. But hopefully I can be a part of it when the time comes to be able to show that we can do nutrition-based interventions to improve mental health in addiction recovery treatment settings. I would love to be involved.
Do you feel like you're facing any suppression when you're going through this, like whether it's writing articles or getting approval for what you just said? Do you feel like there's a bigger agenda that's suppressing this information?
I think that the nutrition field is one of the most marginalized fields that exists. I have felt nothing but oppression, especially being a registered dietitian, right? I mean, it is a very controversial degree. There's a lot of conflicts of interest in my field. There's a lot of overlap with my parent organization and big food companies. So there's been a lot of loss of public trust. And it definitely feels like the food industry has their teeth in everything, right? The mega corporations have really done a great job in infiltrating organizations and creating front groups. And, it's funny that you asked that because, I have a couple papers right now on ultra processed foods and mental health. How do, NOVA classified 4 ultra processed foods impact mental health? What are the mechanisms? And we had some difficulty getting them through some of the journals. And I started to scratch my head and wonder what's going on here, right? And, I'm not going to name any journals or say any names, but, it was obvious to me and some of my co-authors that there were food corporation moles on journal editorial boards, like that they actually, right, these mega corporations that employ PhDs and other scientists, they will encourage them to sit on boards and be editors in journals. Here's the really interesting part. If I publish a paper in a peer-reviewed journal, I have to disclose all my conflicts of interest, right? If I'm in cahoots with an organization or I've received funding, it could potentially impact my research questions, my conclusions, etc. But a peer reviewer doesn't have to disclose that. So it's a perfect opportunity for someone that's just got so much conflict of interest to maybe they're not going to write a paper, but they're going to get positioned to be a gatekeeper somewhere. So yeah, this information about food being profound for mental health definitely is suppressed by big food, big pharma, etc. And, this conversation's not new. We all know that food has medicinal properties that have been suppressed. But I faced it at the university level. And I've been facing it my whole career, and I've been calling it out. And sometimes I think calling it out has only caused me more problems. You know what I mean?
Yeah.
I'm going to do it anyways.
That's amazing that we get to hear from somebody because if you're looking into health and just science in general, you can see that there's suppression of information, and it starts at the peer-reviewed level. But that's what everybody classifies as the golden standard of what we should be listening to, is the peer-reviewed published articles. But there's something in there, like you said, it's almost it's a unfair bias when the actual reviewers can have conflicts of interests.
Yeah, it's funny when you look online, you see people that are really trying to be super scientific, and it almost feels like they're in like a cult or religion of science where they just worship peer-reviewed papers, right? As the only thing that matters. But when you're actually in the game, you start to see how much bias there is in the funding, in the publication, in the peer review process. And you realize that, yeah, if some very intelligent forces can infiltrate that, then it trickles down all the way. It trickles down to the average influencer on Instagram who's sharing about the paper, arguing in a forum, right? It just trickles down and it creates this confusing misinformation. And this has definitely happened in the nutrition space, and especially in the eating disorder space, right? There's just a lot of contention and debate about what's true and whether foods are safe and should be included. And, you know, they're smart enough to, and this is what, you know, what we see at the highest possible level. They bring in social justice issues to make them emotionally charged, so that it's no longer just about facts, it's about feelings, right? You can attach feelings to information and get people that have been marginalized to speak up, and then it becomes this very tiptoey, walking on eggshells. You can't say this anymore. You know, you can't talk about health anymore because it's triggering. And it's just this genius, effort to create confusion among the masses and have us fighting amongst ourselves rather than questioning the larger systemic structural issues.
How many papers have you been a part of that have been published, and what's your favorite one?
Oh, great question. I have about 20 peer-reviewed journal articles. There's about 6 that are currently in press and in review. So I got really busy in December. I cranked out a bunch of manuscripts, some of which are from my own private practice. So, it's possible that my favorite are about to come out. So I'm not going to speak on those, but it definitely felt great to be able to be a part of the entire chain, from getting an IRB submitted, being a clinician who works in the field, who collects data from his patients, doing the statistical analysis myself, which I'm able to do, right, with coding at a very high level, and writing the manuscript, submitting it, and getting it published. That's a process that usually involves several different people with different areas of expertise, and I'm very proud to have been involved in each step of the way. But to answer the question about my publication history, there is a paper called Separating the Signal from the Noise: How Psychiatric Diagnoses Can Help Discern Disordered Eating from Dietary Restraint. And it's a review paper that has some clinical vignettes, and I won't get super deep into it, but basically what it is an effort to teach people how to think in nuance, to think in the gray area, as opposed to thinking about this is an eating disorder, this is food addiction, which are very seemingly opposite ideas for a lot of people. And they overlap. People seem to have a hard time thinking in terms of overlap, thinking in dialectical terms, right? Which is what we call the both and rather than the either or. So in statistics, we talk about a signal to noise ratio, that you're looking for a very clear signal. In statistics, we have, mathematical signals, but if you think about a signal out in nature, in the forest, right? And you have noise in the background. There's a lot of noise in the background. And what you're trying to do in a statistical analysis is separate the signal from the noise. To how confident are you that the signal you're getting is actually the signal rather than the noise, right? Mm-hmm. And that's what we use p-values for in stats, et cetera. And I've been very interested in food addiction, what we now call ultra-processed food addiction. And I think I maybe said the paper wrong. It's how psychiatric diagnoses can discern food addiction from dietary restraint. It's a food addiction focused paper that really did a great job, in my opinion, of helping people understand if someone has food addiction symptoms, how can you be confident that what you're looking at is actually someone that has a legitimate, genuine addiction-like relationship to food? They have food addiction versus what could be binge eating disorder. It could be a lot of dieting. It could be a lot of different things, right? So I noticed that in my field, this was a major area of debate. 2016, 17, 18, 19, there was just like wars online in the eating disorder community. Patients were falling apart. People would come to me and say, are you, this person said this person said this. And the paper really was for clinicians and researchers to understand that there are ways to do deep dives with our clients using research assessment tools and structured interviews to really figure out what's going on with these people. And the main point of the paper, and I guess this will be the last tidbit about it, was that we have to integrate trauma. We have to look at adverse childhood experiences. We have to look at PTSD symptoms. We have to look at the entire life history. We have to make a timeline in some cases and think about how early life adversity and how trauma can actually impact someone's relationship with food, how it can increase risk for addiction-like eating, and how some of that may lead to quote unquote eating disorders, et cetera. So that paper has been cited and pretty well received. It's long and there's a lot of literature review, but once you get through, it's open access, by the way, which means anyone could read it. Once you get through the literature review, which is like the part where we go over the 150 or so studies that need to be cited, the paper just opens up into this discussion. And there are 3 clinical vignettes, which are, fictitious case studies that really help. They're like an exercise for the reader to learn more about food addiction versus eating disorders.
Can we go down a little bit in that trauma relationship? Because you mentioned it, but could you, for the person listening or watching, what do you exactly mean by that? For me, it seems like there could be like that's the origin of it, but I'm not sure if you could clarify on that.
Yeah, absolutely. There's a lot of different, forms of trauma per se. The most researched ones are the ones that happen in early life, right? So there's something about exposure to adversity. By the way, not all adversity becomes trauma, right? We know that there are people who are resilient that have had, parents be divorced and not, experience PTSD, complex PTSD, or other related outcomes such as anxiety, attachment disorders, et cetera. There are different types of early life adversity. And this was actually what I ended up doing my PhD research on, adverse childhood experiences. So this is something that I'm deeply interested in. There are forms of adversity which are considered childhood maltreatment, which are things like physical abuse, S.E.P, other forms of, direct contact that are the most notorious for, creating life course negative outcomes. And then there's a category called household dysfunction. This is when someone is mentally ill, someone goes to prison, someone's using drugs and alcohol in the house, right? So this is a different, category. And there's been some debate, which ones are worse, right? Most research suggests that, childhood maltreatment is the most deleterious to health. But we also have childhood adversity that happens in the community. So in the schools, someone could have a really good home and then be bullied in school, right? Have a lot of, othering or denigration or marginalization or in the community. There's a lot of different reasons. Now it's like internet bullying, right? A lot of ways that someone could feel compromised and basically, it can affect their sense of self and ascribe meaning to it. So one of the areas about trauma that I got into, and again, I mostly focused on the first 18 years of life. There's a lot more, adversity that can happen after that. We also know that people that have a lot of ACEs are more susceptible to the effects of later life trauma, which is an important piece as well. Someone that had a pretty strong upbringing might not be as shaken up by the breakup at age 25, if that makes sense, right? Mm-hmm. So like trauma begets trauma, right? The nervous system keeps the score. But I got very interested in what we call the biological embedding of adversity. This is when you look at the mechanisms that link trauma to things like addiction, right? So you think about how does trauma and adversity actually change biology in ways that explain the risk. So for example, we know that people who have a lot of ACEs are more likely to use illicit drugs, intravenous drugs. They're more likely to binge eat. They're more likely to have an eating disorder, right? And so I kind of stepped into the place of trying to answer the question of like, well, why? Right? Like, what is okay, that all makes sense. Early life trauma leads to addictions and eating disorders, right? And depression and anxiety, and basically the whole list, the entire list, suicidal ideation, any health outcome is linked to ACEs, okay? And, the question becomes why? And what I learned a lot about was what I'm going to call discipline bias. How different disciplines might study this phenomenon, right? So for example, a social scientist might think about, socioeconomic status, right? If people that have more ACEs, and we're not talking about individuals right now, we're talking about groups. People that have more ACEs might be more likely to have, to live in less safe neighborhoods or have, right, less resources, less access to healthcare. Their parents aren't as educated, right? So this is a social link between childhood adversity and negative life outcomes, right? Is that, and again, no models are perfect. They're all incomplete, but they're all used to explain the phenomenon that we see in this world, okay? We know that people from very wealthy families with great doctors that have childhood adversity can have very, very negative outcomes as well. But it's one explanation. The other explanation is just the psychology of it. Like I said, attachment issues, abandonment issues, the ascribed meaning. What does it mean that someone touched me, etc.? And that can definitely become thematic throughout one's life. It can affect their schemas, their senses of self, and it can play out in relational dynamics, right? But then, of course, the last piece, and I think this is the piece that's, most interesting to people because it's the most scientific per se, is the biological mechanisms, right? Another one of my favorite paper, and I'll get there in just a minute. Another one of my favorite papers was I did a systematic review and meta-analysis linking ACEs to BMI in adulthood. So we showed that people that had multiple ACEs were 46% more likely to live in larger bodies, to have BMIs above 30. Okay. And this was like part of that initial deep dive of like, why is it that people with childhood trauma live in larger bodies, are more likely to be addicted, etc. And, there's a couple reasons. One of them I already touched on earlier, which is the immune system, inflammation, right? We know that people with a lot of trauma have immune responses that can be prolonged. So people that have been exposed to a lot more adversity tend to, not always, have higher levels of inflammatory markers. Things like C-reactive protein, interleukins. They tend to have a higher baseline inflammatory signal, right? Which is super significant if you think about it. These are very small differences, but cumulatively over the lifespan, they can make a big difference. So for example, like I talked about inflammation impacting the brain, impacting mental health, right? Speaking of the brain, we've also got structural and functional and morphological changes in the brain that are associated with certain types of trauma. For example, the hippocampus and the amygdala, they tend to, change shapes, right? Hippocampal volume can be decreased. Hippocampus is responsible for memory in the brain. And so when there is systems that are in our biological makeup that become off, other systems become off as well. So it's a systems biology question that isn't like a straightforward answer, but the different mechanisms that I think summarize the biological embedding of adversity is the immune system, the brain, and the brain also includes the reward pathways. So basically, what ends up happening is the brain starts to learn that dopaminergic substances are self-medicating. If someone has a lot of unresolved issues, it's going to make the dessert at 10 o'clock be more rewarding compared to the person who doesn't. You following me? So the person that binge eats at night to make negative emotions go away, they're having what we call salience. The brain is assigning more value to that experience. So they end up overlearning it and becoming what, can lead to addiction. So it's and there's the HPA axis, which is responsible for the output of cortisol. We know that can be changed as well. We've got data on changes in the microbiome. But again, there's a lot of unanswered questions. Which comes first? Which one is the most important? But we think about, hormones, stress hormones, the immune system, right? The brain, and how they all sort of interact together. But in a nutshell, we know that people that are exposed to trauma have altered reward. It changes the way that reward is evaluated and that value is assigned. So it makes people more susceptible to drug and alcohol use, more susceptible to food use disorders, caffeine, nicotine, anything that is addictive is linked to early life trauma through various mechanisms. And I'll say this and, shut up for a minute. The association between trauma and addictions is so strong. And once you understand the mechanisms, it becomes much easier to counsel people, to work with people, as opposed to this very vague sort of, yes, we know that happens. Once you understand the mechanisms, there's not shocking why people have a hard time changing their behavior. And it's also super important to help people that have a trauma history feel safe, feel understood, and feel like the person in front of them isn't judging them, right? So trauma-informed work involves understanding that change is hard, and there are other barriers for people to make health-related changes other than just motivation and cognitive processes. There's a lot of other factors. And then the final question becomes, if it's true that, trauma affects the nervous system. I didn't even get into the vagus nerve and the nervous system. I mean, there's probably 4 other mechanisms that I didn't get into. I was really focusing on the ones that are most linked to addiction. Okay. Once we understand how trauma affects all these different systems, the question becomes, what can we do nutritionally, right? How can we change the way that we eat to improve, someone's likelihood of having a positive health outcome after a lifetime of early or adversity?
That was a lot to unpack. Thank you for going that deep in it. One thing you said was self-medicating foods. And I just got this image of people literally associating, like you said, reward gets a little bit skewed. They're associating that experience of eating Cheetos at 11 p.m. They're associating that as like turning off the switch of the negative feelings they're getting with the trauma. Mm-hmm. And that's the addiction. That's what starts the addiction. It's not just addiction because you have a problem. It's the body searching for a way to respond to the pain of the trauma, and it finds the answer in the food.
It finds the answer in the dopamine, right? The neurochemically rewarding processes, and the food tends to be the easiest route toward that, right? It's such a predictable response, right? You are going to be able to access food all times a day. It's usually pretty cheap, convenient, and it's predictable. And that's one of the reasons why, food issues are so difficult for people to tackle, because, it's equated to survival promoting activities, right? Like food is dopaminergic because it helps promote survival of our species. And then we're getting that system exploited by major food corporations who make food to be more dopaminergic through ultra processing. And then when you have someone who has a significant trauma history and has, addiction vulnerability, and then the food environment is filled with ultra processed foods, it's kind of like good luck. We're going to need a serious type of intervention, not just a meal plan, not just a supplement regimen. We're going to need a serious mind-body healing effort with recovery, and it might take months. And that's the part that's difficult for people to remember, that doing deep, trauma-based nutrition healing work is a process. It's not an event. And it could take some time before you reverse some of those systems we talked about. And it might be a couple years before you stop binge eating. And if that's the case, like, strap on, sign up, let's go for the ride. It's right. Worth it. Be patient. You know what I mean? People expect nutrition and body issues to like switch over the course of days and weeks. And I have to always remind people, we're talking about months and years here.
Speaking of solutions, talk to me a little bit about Wise Mind Nutrition.
Yes. So I've done a lot of eating disorder work, and I've done a lot of food addiction work. And, the framework and the mission for Wise Mind Nutrition was birthed from a few things. One was to integrate those two, to integrate these polar opposites in the nutrition world, the polar opposites of, the food environment's toxic, you can't trust anything, don't eat any of it, and the sort of eating disorder, mental health recovery message, which is like, relax, ease into it, stop tripping so much. You're making too big a deal out of this whole thing. So it's a very concerted effort to merge those two energies so that people don't feel like they have to choose between dieting and non-dieting. And I hope that makes sense to some of our listeners. There is a way to be intentional and deliberate about food without turning it into this rigid pass-fail type of approach. So that's number one. It's gentle, but it's deliberate. It's teaching people about nutrition without conferring any risk for a new disorder, right? It's not like triggering. It's safe and it's gentle. The second piece is really to think more about these other mental health outcomes. We have 7 randomized controlled trials that show that nutrition can improve depression and depressive outcomes. So, why aren't we developing protocols to help people that have treatment-resistant depression use nutrition to improve gut health and to improve mental health? So I pulled together a lot of the research. A lot of it points to Mediterranean-style eating, right? So more fiber, more colors, the right kinds of fats, right? And I just put all of that information into a step-by-step process that's very slow, right? So, I could tell someone, yeah, the Mediterranean style of eating is the best diet for mental health. You could tell someone that. They're still a very long way away from eating the Mediterranean style of eating. So, from 10 plus years of working with people one-on-one, I'm like, what are the steps to get someone from where they are to where they're actually doing it? And this is when we start thinking about beverages and movement and sleep. And then, of course, if they're going to make nutrition changes, how fast or how slow should that be? And it's going to vary from person to person. So it's a food log. The third part of it is a food log, which is designed to help coaches and practitioners provide support for their clients, especially if someone is a mental health professional and the nutrition stuff is a little bit outside of their scope. You can outsource that to me. I will provide the education through the app, and you can just provide ongoing support. So it's a great tool for people to connect and share their journaling and their food logs, etc. And then, another component is the data-driven part of it, which is that we don't have enough information out there about how nutrition can improve mental health. And I think a lot of people aren't yet convinced. So I'm saying use the app and see for yourself. When people, sign up and start the journey, they're going to fill out screening tools for depression, anxiety, PTSD, ADHD, food addiction, eating disorders, and really just check in based on a self-reported measure. Where am I at with these things? And then the app starts to give personalized or targeted information based on their mental health scores. So if someone has, for example, high levels of depression, there's going to be some recommendations, some supplements, some additional things to consider as someone goes through the modules and does the day-to-day program. And I think the coolest part about it, and at the end of the entire journey, and of course it never ends, you're always welcome to continue through the process, one can see how their mental health may have improved over, several weeks and months using nutrition. And, I think that, it's been my experience when people actually go through the program and they're like, wow, my anxiety's down, my PTSD symptoms are down. I really feel amazing about this work that I did. I'm going to keep doing. I'm going to run through the whole cycle of material again. It is a little bit technical at points. I can't help it because I have a scientific background. I do feel like because this is a new conversation that I have to include some citations, because I'm not making this stuff up, right? Like we're talking about very new things. So there's a couple parts of the app that I think appeal to professionals and clinicians more than the average person. But I put in a lot of work to make it gentle for people that are getting nutrition information maybe for the first time. And, there's assignments in there. It's a place to do some work, some healing work. And I'm really proud of it. It's relatively new. We're still making improvements to it. And one thing I've learned from entering the tech space is that never ends. There's just an ongoing iterative process where you get feedback from the users. You talk to people that finish the program and you think about ways that you can make it better. And you just want to. I just want to keep making it better. We're going to add more programming in there, like little mini courses, things like, who knows, night eating, more specific nutrition for ADHD. I'm really trying to become a hub for the nutrition for mental health conversation. And, I built an app so that I could make options for people that are no cost, low cost. Insurance doesn't always cover the nutrition work that I do. So a big other reason why I created it was so that people who didn't have resources to afford working with me could have a place to go. And, when people do the Wise Mind Nutrition app and are able to work with a coach or a provider, the outcomes are so incredible. And I'm just super excited for anyone who hasn't tried it to give it a shot.
Can they find providers of information on the app?
No, but it's a great question. I am working on a sort of mini certification for providers. So to become a, wise mind nutritionist. And at that point, people will be able to, they'll be vetted. So that I've trained them and approved them to do specific nutrition for mental health work. So that's definitely on the radar for the near future. Thank you for that question.
That's amazing. I mean, the fact that you have this abundance of scientific experience, it's real, right? You're not just an average influencer who just decided to make an app. I mean, even though that's great that anybody can do that, but you're trained in many different areas, and now there's an app that has huge potential. It's also like there's a social aspect to it as well, right? Like you connect with other people.
Yes. And I would love to see, it's a difficult, piece, because a lot of people that have disordered eating and sometimes are suffering in silence. You know what I mean? So it isn't the kind of conversation that lends itself to like, I'm out there in the world, right? With night eating and binge eating, there's still a lot of stigma around it. So, people are, whereas like in the addiction space, people have a little bit of recovery pride. I think with the food and body issues, we're not like there yet. So I'm really trying to think about ways that we can reduce some of the stigma around like food and body related disorders so that people will feel more inclined to be in a comment section or in a community, et cetera. But yeah, it's not impossible that a small group of people, and I've had this in some 12-step groups and in a sober living or two, just all follow each other, and are giving each other support through the app, rooting for each other, send someone a message, let them know you looked at their food logs. And we know that social support is a critical part of recovery from addictions, eating disorders, and I'm pretty sure all mental health outcomes. So that's built in there so that someone could basically not feel alone. But interestingly, because I obviously have access to the back end data, it seems like there's a lot of people that just kind of want to go through the thing solo, and not make it a thing and, make it an individual journey and just go through on their own with no connections. And it seems like those people are doing fine. But yeah, I want to see people living recovery out loud in this area a little more. And I think that I have some work to do to reduce some of the internalized shame and stigma that still exists around food and body stuff.
We're moving into that stage. I've been teaching people and leading people for over 20 years. And what I've noticed is that the top, one person giving information to a classroom, that's the old style, and it's inefficient compared to a circular style where everybody's learning from each other's experiences. So one thing that I know that you bring up a lot, which I have came to the same diagnosis as well, is that the sunlight is massively underrated in terms of health, in terms of wellness, in terms of basically everything. And so could you share a little bit about what you know about the sun? But what I'm really interested in is when that switch happened.
Yeah.
Like at what point that you're like, oh, wow, this source of everything is actually important for us?
It's actually a quite vulnerable personal story for me as well. I know a little bit about the science, right? It's not just vitamin D for everyone who's listening. There's also, right, serotonin involved. There's cofactors for processes in our body. Most people think, well, if sunlight's just vitamin D, you take a vitamin D supplement, you're fine. It's not. We're not talking about just vitamin D. But yeah, I have a very pale sort of skin tone, and I was a night dweller for many years. And so, personally, remembering when I started my life over in 2006, lying out in the sun and feeling like I was receiving source energy from nature almost for the first time, right? Like it was very clear to me that there was like just a magnitude that I had been missing, right? The same way some people, when they get barefoot and put their feet on the earth, they feel something. The same way when some people hug a tree, there's some level of connection that's been missing. That feeling of this has been missing was profound for me. I could feel like my blood circulating differently. I almost felt even like just aroused by the sun, in a meaningful way. And I say it's a vulnerable story because, I took it pretty far. I did. And, there's so much benefit to it. And, this was like 2008, 2009. I'm going to say it on the air. I did it. I went into tanning salons, for like about 2 years. And I loved the way it felt. And this was like the person in recovery that had a history of addiction. You know what I mean? There was just nothing better than that feeling of, and I don't believe tanning salons is the same thing as the sun. We're talking about totally different things, right? But I lost the connection to the source energy, and I wanted to look good, and it gave me the dark skin, but it gave me some sort of an effect. Anyways, fast forward, many years later, I got lots of little precancerous things on my face, right? From being such a fair-skinned person, and there's some skin cancer in my family background, right? So, one of the things that I had to do, and this was many years ago, was like reevaluate, my relationship with the sun. And here's what I learned, if I don't get any, my vibration falls and I get depressed. And so for the last, maybe 10 years, I've had to do this really delicate dance of connecting to, I do naked sun exposure, mm-hmm. right? I believe that that is the way to go if you have a place where you can do it. And I cover my face, because I no longer want that level of exposure. And of course there are, different things that we can apply, et cetera. But I get it. I get sunlight for a much shorter period of time. I'm kind of like, I flip over a lot so that there isn't a lot of prolonged exposure. And to me, and again, everyone has different biology. It is the thing that takes me out of my rut. It is the thing that takes me out of my low spots. And even with my high degree of risk for negative health outcomes, I still put it at the top of my list as something that I have to do. And it's a sensitive topic for me. I'm an open book, but there's been a few times when my dad has looked at me like I'm crazy if I'm going to like go get a little bit of sun. And I don't have skin cancer. I just had a bunch of stuff frozen off, if you know what I mean. They have this sort of nitrogen procedure. Looks at me like I'm crazy, and I kind of look at him like, I don't really have a choice. My mental health comes first. My mental health is everything. So sunlight and sunlight therapy is critical for my mental health, and I believe in full body exposure.
Mm-hmm. I mean, I just want to add to that full body thing. If you are covered, like let's say you have a swimsuit on, right? That's a large area of your body that's not being exposed to the sun. And your body gets confused because it's like, are we inside? Are we outside? And it's unable to fully take in the light into the body. And so it's not just about like going out and being naked and like, just being naked to be naked. Like it's really about like the design of the human body. Clothing is something that is very disruptive, even being outside in cold temperatures when you have clothing on and like socks are really close to the skin, but then your shirt is really loose. That also, if you talk to people that are really hardcore survivalists that like live in nature without homes, not even tents, they're like sleeping under trees and stuff. Wow. They'll tell you to have one membrane for the entire body, like a blanket, consistent. As opposed, exactly. And so it's similar with the light because the body gets confused otherwise. It's trying to send heat energy to one part of the body and cooling off another part of the body. And it's just that's confusing to the body. Thank you for sharing that information, that story, rather, by the way. It's very meaningful because a lot of people have had issues with tanning booths and or overexposure to the sun, and there's a lot of convoluted information about it. And to hear you basically say, like, you still find that it's important, even if it's a few minutes or a short period of time. And I'm on the same boat. Like, I go outside to get sun almost as high of a priority as I do eating.
That's right.
Like, it's something that I do every single day, and I can feel the difference totally. The sun's so right. It's so disinfecting, like even to things like germs, or it can clean stuff,
yes.
right?
Yes.
And it does that with us. Even if I'm using my devices, if I go outside and use my device outside in the sun, it almost fills in all the missing components of the screen light that's coming into my eyes, and I feel better. And the same thing happens with thoughts. Anyways,
I'll add something to that.
Yes,
I've done a lot of my deeper meditation out in the sun and falling asleep for a few minutes, right? It does like a little quick reset to me. There's something about that falling asleep, sometimes for 10 or 20 seconds in the sun, that has a deep transformative effect. And what I can add is I've also done sunlight sessions where I'm, lying on my stomach and just doing the phone thing for the whole time. And they're different. The sunlight exposure sessions where my phone is not with me, it hits different than the one that I'm doing, right?
Mm-hmm.
And I don't know how much of that's biological and how much of it's in my mind, but I've seen that pattern very consistently.
Yes. All right, moving on. I could talk about the sun all day long. The something I was listening to you say was Nova classified for foods, and I've never heard of that, but it was in relation to ultra processed foods. What is Nova classified?
Yeah, so there's a classification system that came from researchers in Brazil, and again, pointing to this important work happening outside of the U.S. We talked about, the mega corporations probably not loving this research. The research separates food into 4 categories. The first is minimally processed food or unprocessed food. Most food is processed to some degree, so we call it minimally processed food. This is like, the corn on the cob, just to give a very basic example. Category 2 is called processed culinary ingredients. These are things that are added to foods, sugars, salts, fats, flavors, other solutions that make food more palatable and also make food more preserved or have a better shelf life, etc. And those are both important things to do to food, right? We, this message of just eat, plain food is like, it's a great message, but it's not practical for the majority of population. We like culinary experiences. Restaurants serve processed food. You know what I mean?
Mm-hmm.
So this term processed food started getting thrown around quite a bit in the last 10 years. And I like the Nova system, and it's pretty well established at this point. A lot of papers have been referring to it. It's got its shortcomings, but it separates processed food, which is a combination of category 1 and category 2 foods. So you take a minimally processed food, you do something to it, and you have a processed food. Separates that from what we call ultra processed foods, which is category 4. These are generally foods that don't have any recognizable intact category 1 foods. So when you look at the food, you can't really tell what food groups are present generally. And these are foods that one usually can't make at home. They're made through a series of industrial practices. So for example, we have the corn on the cob is the category 1. The canned corn is the category 3, because, canned is a processed version of the corn, right? They've cut it, they've washed it, they put it in a solution and then canned it, right?
Mm-hmm.
Category 4 version is the Dorito, right? They've actually taken the corn, turned it into a powder, into a sludge. It's been shaped, it's been fried. And, the the deal with category 4 foods is that they've been ultra processed to the point where a lot of the nutrients that are inherent to the food are no longer there, right? So we've got a loss of beneficial nutrients, especially the sensitive stuff, right? The phytochemicals, polyphenols, like those things aren't surviving ultra processing. You know what I mean? We lose some of the micronutrients. We're left with the macros, right? We're left with the fast absorbing carbohydrates, et cetera, possibly even turn some of the fats to be inflammatory. And then there's a host of other negative things that come along with the ultra process in the process, the high heat, jarring, these byproducts of the packaging are also really important. The plastics and the bisphenols and the phthalates, and there's a lot of nanoparticles and just other things that are adverse about ultra processed foods. So you get this really interesting combination, is that ultra processed foods are foods that have had the nutrients removed, and you've had a lot of things added to it. And so it's hard to know which one is worse for health. Is it because there's no real inherent value to the food, or is it because it's got toxic things in it, right? And I think both are probably true, but as a scientist, it's hard to disentangle those, if you get what I'm saying. Like, if someone eats mostly minimally processed foods and they eat a little bit of ultra processed foods, are they okay? Usually, yeah, they're usually fine because they have a lot of the other protective stuff in all the other food, right? But what we're seeing is that in the US, recent estimates are something around 2/3, 60% to 2/3 of the calories consumed in the United States are ultra processed foods.
2/3.
Yes. We have children growing up eating almost exclusively ultra processed foods. And this is the chicken nugget, you know what I mean? The chicken that's been, right? Eating almost exclusively ultra processed foods and very little, category 1 minimally processed foods. And this is when we have a real problem, right? This is a real problem for mental health. And there's times, and, I'm a parent, there's parents out there that say, like, this is the only thing my kids will eat. And it's like, all right, we're like kind of entering a problem that's difficult to reverse at this point. Big food corporations, they kind of won, and then of course, now we live in the era where if people say anything negative about ultra processed foods, there's someone out there to say you're promoting dieting. This is diet culture, right? It's just this big conundrum of confusion. But at the end of the day, the message that I can convey, in 2024, it's the same thing that I said back in 2010, and you probably said it too. It's just like, eat real food, if you just keep it simple and don't get lost in all those other details, and you eat from all the different food categories and you get a lot of variety, right? Like you're on the right track. The problem with that is that people's reward systems have been conditioned by the ultra processed food to where eating real food is no longer pleasurable. It feels like a bummer existence. You're eating bummer food. You feel like you're dieting. Life becomes gray. And that's the real problem. That's where it comes back to the trauma, right? Like, people have had biologically embedded adversity. They're susceptible to addictions. And the message of, like, go to the grocery store, cook food, eat real food, drink green juice is almost impossible to carry out because of all these other factors that are going on. So yes, we need to eat real food, but the question is, how do you take someone that has impulsivity, that has anxiety, and how do you turn them into someone who actually likes to eat real food, right? And that's the work, right? The steps that one can take, and that's definitely who I built the Wise Mind Nutrition app for.
Yeah, and it's possible.
It's possible.
So it's definitely possible. You actually threw me off there because you said 2/3, and I was like, wow, that's a huge percentage. But then I remembered back to middle school, and I think more than 2/3 of my diet was ultra processed foods. I mean, even just the school lunches, but I never even went to the school lunch line. I would go to the snack line, and I would eat Gushers and fruit roll-ups for lunch in school. And then there's whatever you could buy in the hallway in the vending machine. And then I would go to hockey practice, vending machine. And it was like vending machines, snacks, and then mac and cheese for dinner at home. for me, that actually got to the point where I wasn't even hitting puberty. I was 19 years old with no armpit hair and trying to play hockey against grown adults.
Wow.
And luckily I was in the gym, and then I first started getting into like supplementation, and then that led me into questioning the food that I was eating, and then I became obsessed because I saw the differences in myself.
Wow. We're so similar.
I forgot that I was just eating candy my whole life, basically.
Yeah, it's normative behavior, for that age group. And I also grew up with the fruit snacks and the Gushers, and wow. Thank you for sharing that part of your story. I'm so relieved to know that you grew up eating ultra processed foods, if you want to know the truth, that you have your own journey of transition. Yeah, I'm really excited to share in that similarity.
Cool. So Wise Mind Nutrition app to help people go through that journey as well.
That's right.
So we got there's something that comes up a lot for me is people are struggling with anxiety, depression, overreaction to stress. What can you tell us that is practical that could help people in that regard?
I believe that a really good place to start is just to be consistent. I work with people that have erratic behavioral patterns and erratic emotional natures. And it almost is less important if it's, if you're on some sort of a time-restricted feeding pattern, or if you eat dairy or not, right? If you're into grains or not, like all those details are great and can be worked out, as we move forward. But I think for a lot of people, just kind of starting a regimen and getting into a routine is just not to be understated. It almost doesn't matter what it is. Obviously, if it's, harmful to health, that's not what we're talking about here. But like, for example, if someone said, you know what, I'm just going to eat 4 times every day, and I'm going to do it at roughly these times. And every time I eat, there's going to be, these components. There's going to be 4 different food groups. There's going to be 2 different colors. There's going to be protein, right? If someone could get into a set of guiding principles that they can continue to do, like consistently for a few weeks, the next step is, how do we manipulate some of those variables, right? And it's not just food when I talk about routine. We're talking about a morning routine, right? A sleeping routine, a breathing routine, a sunlight routine. I do believe that at some point in our lives, like the key to freedom is maybe being able to break out of some routines and to be able to experience some flexibility in our lives. But for people that have anxiety and ADHD, find a routine and just stick to it for a few weeks. And when I say stick to it, I don't mean eat the same breakfast every day, right? I don't mean do the same workout. I mean have consistency. Consistency with food leads to consistency with life. And that has been a core message of mine. And once we establish some consistency, the body starts to feel like it's safe, and it can remember, that it's safe. And once it can get that safety signal, it can start to heal. So when one day you eat breakfast, the next day you don't, right? One day you go to bed at 2 a.m., the next day your body is in this erratic pattern of shuffling and trying to figure out where it can land to find its homeostasis, right? So it's almost like using trauma-informed treatment, with lifestyle medicine. It's like, let's just create a signal that's consistent. And then once you do that, the nervous system recovers and you land. And then you could say, all right, now let's start.
I love how simple that is. And it's so profound the way that you explain it.
Right on.
If everything's erratic, like,
good luck.
No wonder.
Yeah.
And I really appreciate your global take on what wellness is. And health. It's not just, and you just mentioned some, it's not just diet and sunlight, but it extends further out into relationships and how what is your social environment like? And I'm sure that's really important in terms of recovery as well.
Huge relational medicine.
Yeah. Anything else you'd like to share with us?
This was fantastic. I really appreciate the opportunity to share about my research. It's difficult to bridge the gap between science and communication, right? And I appreciate your encouragement there to be able to connect some of these dots for people that don't just want everyday information. They want stuff that's backed in research. And, the real question is, how do we translate that into our everyday lives? And I think we cooked some of that up today, and I really enjoyed.
Thank you for being public. I don't know if you identify as a scientist, but for the most part, the influencers are the ones that have to go and see what the scientists are saying and then just kind of repeat out to the public that's listening. But if, you kind of remove that unnecessary step by you coming out and sharing what you're researching and being able to talk about it in such a simple and dynamic and usable way for people to understand and really make lasting change in their life is helping a lot of people. And I think that we did a good job in this interview doing that as well. Okay. So thank you so much for coming.
You got it.
Coming on.
Right on.
All right. Take care, everybody. Once again, wisemindnutrition.com, Wise Mind Nutrition app, and at Dr. David Weiss on Instagram. Awesome. All right. Let's end this.